Good afternoon. Thank you guys for joining me. My name is Jessica. I'm one of the nurses here in the emergency department. Today I'm going to be talking to you about improving safety of clinical alarm systems as my fall project. So the Joint Commission actually, as they go through hospitals, come up with safety goals, national patient safety goals is what it is. And then the alarms safety and management of them was identified as a high priority one. Kind of for two reasons, and we'll go over that as we go along through this. So improving safety of clinical alarm systems. So although they are set out to save lives and do positive things, alarm healthcare workers of abnormalities, anywhere from ventilators to cardiac monitors to beds, they're used for safety tools, but they also can be associated with negative patient outcomes as well. For two reasons. One is that the abnormality may not be detected or may be hard to detect in some monitors, so therefore it's missed. And then another more common one is that it leads to alarm fatigue, where the alarms ring continuously for false reasons. People become desensitized and then therefore do not respond appropriately when the alarms are actually needed. So the importance of improving the systems, obviously, if it's not caught, the patient is at risk for the poor patient outcome. And then once the patients, or once the healthcare providers are desensitized to alarms, they, as we mentioned, will miss the important stuff. So things that can alarm, cardiac monitors, sequential compression devices, ventilators, beds, infusion pumps, feeding pumps, pulse oximeters, balloon pumps, and such like that. Some statistics that I found in doing my research, a study of the ICU at Johns Hopkins proved that the staff was exposed to an average of 350 alarms per bed per day, which is a whole lot, and it's super overwhelming. And then of those alarms, 40 of them were different sounds. So you have all kinds of different sounds that you have to learn, which I'm sure are different from facility to facility, which can be challenging for someone who's new or agency, stuff like that. Research shows that 85 to 90% of the alarms that do alarm are false. About 1% of all alarms in the inpatient setting require therapeutic interventions. So that's very small compared to the amount of alarms that do go off. And in the emergency department, a study with patients that presented with angina or that were low-risk coronary artery disease patients, 0.6 of them required intervention, so it's very low. One study showed that nurses take up to 40 minutes to respond to the alarms, differing alarms, cardiac, call bells, stuff like that. Another study showed that healthcare providers only responded to 10% of the alarms that went off. Lots of silencing going on, I guess. So case scenario, you've worked all day, 4 days in a row, you leave a patient's room and he's lying in the bed talking to his family member. The patient is on a cardiac monitor. You walk out of the room, go to the nurse's station, and the VFib alarm goes off. You glance up at the alarm, you push the silence button, and then you look at your patient. You can't see the patient because the curtain is halfway pulled, so you can't see the face, but you can see the family member talking with the patient. What do you do next? Anybody?
Go look at the patient.
Physically check the patient.
Absolutely. So check your patient every time. How many times has your VFib alarm gone off and the patient was not in VFib? Probably quite a bit. So situation, this is a true story, this really did happen. The nurse did respond, patient was in VFib arrest, got the appropriate interventions, thank goodness, and made a full recovery. So the takeaway from this is that the alarms may not catch every abnormality and they may go off a whole lot, but we do need to do what we have to do and check patients every time. Alarm fatigue. So although safety alarms are intended to save lives, as we discussed earlier, sometimes they are associated with poor outcomes. Therefore, the Joint Commission has identified this as something that hospitals do need to take a stance against. The healthcare workers are becoming overwhelmed, desensitized, and have trouble recognizing the many alarms. Tackling the problem can be challenging because, you know, there's a fine line between reducing the amount of alarms that are needed and then missing things. So the Joint Commission recommends putting a task force together for hospitals. A hospital, Boston Medical Center, led the way and actually started this before it became mandated as a national patient safety goal, and it started doing little things. They widened the parameters. I think it was from 80 to 130. 80 to 110, and they 60 to 110. They widened it from 50 to 130, I think it was, and then also made a 2-nurse checkoff where, like, if the patient's bradycardic, they're always bradycardic. They live at 50 to 55. They would have 2 nurses go in and say, you know, let's look through the chart. This person, you know, this is their average heart rate. Let's together sign off and lower the parameters for this specific patient. So they started a few things like that. They put some of the alarms on the med-surg floor on crisis mode versus the default setting ones, which reduced the alarms to only the emergency abnormal rhythms. So they had a good outcome with that and had a lot less alarm fatigue due to those changes that they made. We've kind of gone over this. There's 40 different alarms in the critical care setting, so it can be hard to learn the different ones. Some of the stuff that you can take action against now to reduce the amount of alarms that go off are, you know, the proper skin preparation, making sure the leads stay on, make sure they're in the appropriate spots, customize the alarm settings for that patient. So if it's a COPD patient, that's always at 89, 92% of pulse ox, so you can kind of adjust that. And then also provide education to the staff about the alarms and the different sounds, the ones that you definitely need to respond to at all times, as well as lots of rhythm recognition classes as well. And then establish a team to actually tackle this goal. So it's not easy because alarms do save lives. So together we must come up with some solutions to tackle alarm fatigue. And these are my references here. Thank you very much for coming.
Great job.
Thank you.
Very appropriate.
Okay, baby.
That was good.